Warning: 12 weird signs that show you're having breast cancer. Feeling a bit off lately? But can't pinpoint why? Subtle yet strange symptoms could indicate a serious health condition like breast cancer. In this video, we'll cover 12 peculiar signs that may signal breast cancer, some lesser known than others. Recognizing these vague clues early can lead to a timely diagnosis and improved outcomes. Catching breast cancer early is critical, with survival rates up to 20% higher when detected in stage 1 versus stage 4. But breast tumors are notoriously hard to spot early. Being aware of vague symptom clues allows for earlier intervention when they crop up. Stay tuned as we explore the sneaky signs suggesting breast cancer may be stealthily brewing. Changes in breast size or shape. A sudden increase in breast size or change in shape on one side could signal an underlying breast malignancy stealthily growing. While it's common and normal for a woman's breasts to be slightly asymmetrical, new overt differences between the two breasts are concerning. Significant enlargement of just one breast. Noticing that one breast now appears smaller or flatter, or seeing that the contours look markedly dissimilar now compared to baseline warrant medical evaluation. The presence of a tumor distorting the breast tissue from within can subtly alter the external size and shape. Keeping track of any new extensions, retractions, or distortions affecting only one breast helps facilitate early tumor detection while it remains localized. Nipple changes. Carefully note any recent abnormalities affecting the nipples, as distortions from the baseline normal shape, skin texture, position, or discharge may betray an underlying breast cancer. Particularly worrisome signs include spontaneous nipple discharge, especially if bloody or from just one duct. Relative to the other side, take note if the nipple now appears flattened, retracted inward, or has a scaly area of skin overlying it. Reddened, cracked, or crusting skin on or near the nipple also deserves evaluation. Recurring pain, itching, or tenderness localized to one nipple area may likewise indicate pathology. Remember that some baseline nipple asymmetry and discharge with stimulation can be within normal limits. It's changes that are new or localized that require prompt medical assessment. Skin changes. Be vigilant about any unexplained skin changes affecting the breast region, as surface abnormalities can provide external evidence of inner malignant transformations. Observe for areas where the skin looks thicker, dimpled, puckered, or pitted. Reddish discoloration, rashes, or scaling need examination too, especially when confined to one breast or portion of the breast, rather than systemic. Classic inflammatory breast cancer manifests with swelling and an orange peel appearance from lymph blockage and skin edema. But more subtle skin findings like localized thickening or solitary dimples also warrant workup. Carefully inspect the breasts during self-exams and report any new or localized skin abnormalities, as surface changes may represent the first external sign of insidious cancer development. Swelling, pain, or lump in armpit area. A new swelling or lump in the armpit or clavicle region adjacent to the breast tissue can be an important early sign of underlying breast cancer. Enlarged lymph nodes often develop due to cancer cells breaking off from the main tumor and spreading locally into the adjacent lymphatic drainage channels. While infections and other inflammatory conditions commonly also cause underarm lymph node enlargement, nodes that are hardened, immobile, or growing larger in the context of breast changes need evaluation to rule out metastasis. The crucial differentiator is that lymphatic breast cancer spread typically does not cause pain or tenderness. Report any new painless masses palpable in the hollows around the armpit, above the collarbones, or along the chest wall for further diagnostic workup. Unexpected nipple discharge. Spontaneous nipple discharge unrelated to breast stimulation or the postpartum period warrants medical evaluation, as this could be a sign of possible breast cancer. While benign causes like hormone variations, medications, infections, cysts, and duct issues are more common, unilateral nipple discharge with certain characteristics raises red flags. Be alert for spontaneous discharge from just one duct, especially if bloody, watery, sticky, or greenish in color. Also note if any pus-like, tan, brown, or black discharge emerges without squeezing or massage. Recurrent discharge between menstrual cycles or occurring in postmenopausal women should be promptly reported. Remember that breast cancer accounts for only 5 to 10% of pathologic nipple discharge, but any spontaneous or unexplained secretion merits assessment. Breast pain. In general, breast pain is very rarely a presenting symptom of breast cancer, though it does occur in some exceptional cases. Unlike normal hormonal breast tenderness, pain stemming from a breast malignancy tends to be localized to just one breast or area of the breast. It typically worsens progressively over weeks or months rather than fluctuating cyclically with menses. The discomfort may stem from a growing tumor impinging on or compressing local sensory nerves. Cancer-related breast pain is usually described as a constant dull ache or heaviness rather than the generalized sore tenderness of hormonal pain. Patients may notice pain that no longer responds to over-the-counter analgesics or their usual remedies. While isolated breast pain only very infrequently heralds cancer, any persistent unilateral pain or discomfort warrants a thorough evaluation. Pitted or ridged skin. Visibly dimpled or pitted skin overlying the breast tissue, likened to the texture of an orange peel, is an ominous finding that should prompt rapid medical evaluation. This abnormality of the skin surface, with ridges and depressions, reflects underlying pathologic fluid accumulation and edema in the subcutaneous breast tissue. Known as peau d'orange, it represents classic inflammatory breast cancer, in which malignant cells have invaded the dermal lymphatic vessels. This blocks normal lymph drainage, causing backup and swelling. The edema just under the skin then exerts outward pressure, creating areas of indentation from the inside pressing out. Often, a large area or even the entire breast surface is affected. This distorting appearance is best visualized with the arms overhead. Any new skin changes resembling an orange peel texture require urgent diagnostic assessment. Unexplained weight loss. Rapid, progressive weight loss that cannot be explained by changes in diet, exercise, or medical status is an important, subtle clue that a serious occult illness like breast cancer may be silently brewing in the background. Malignant cells and secreted factors can impair appetite and caloric metabolism through multiple mechanisms. Tumor encroachment in the pancreas reduces insulin output, resulting in cellular starvation and the use of fat and muscle reserves. The release of metabolites also speeds resting metabolism, and tumors directly damage tissues involved in nutrient absorption over time. Patients describe persistent hunger without weight gain. The unwarranted weight loss accrues insidiously but becomes obvious over time as clothes become loose-fitting and the face appears gaunt. Gradual unintentional weight loss of greater than 10 pounds warrants evaluation for underlying cancer or other illness. Breast lump or mass. A new palpable lump or mass within the breast tissue is a cardinal symptom that should prompt medical evaluation, even if the mass is very small, painless, or seems to fluctuate in size. Benign breast cysts and fibrocystic changes are far more common than cancer, but the only way to determine the identity of a concerning lump is through imaging and possibly a biopsy. Typically, benign masses are movable, smooth, and firm rather than hard. But any palpable abnormality noticed during self-breast exams or incidentally merits further assessment. Location within the breast does not predict malignancy. Breast cancer can arise anywhere from the nipple to the periphery to the chest wall. Patients should not be falsely reassured by a lack of pain or by normal mammogram findings. Any worrisome new mass warrants a triple assessment with a clinical exam, imaging, and biopsy as needed to exclude cancer. Inverted nipple. Sudden development of a nipple that inverts or pulls inward compared to its previous normal averted shape could portend an underlying breast cancer exerting distorting traction from inside the breast tissue. Nipple inversion or retraction is most concerning when it represents a new change from the individual's established baseline appearance, particularly if it is unilateral. Some women naturally have inverted or flat nipples, which is benign, but any nipple distortion deserves evaluation to determine the etiology. Palpation of a new underlying mass fixes the nipple inversion by tethering it at a single point. Enlargement of the milk ducts may also exert central traction inward. But most commonly, a growing breast tumor deep within the breast parenchyma places inward pressure on the nipple ducts and stroma, causing nipple inversion. Any change in nipple protrusion warrants prompt examination, as it may be the only external manifestation of an otherwise clinically occult cancer. Breast warmth, swelling, or redness. New feelings of warmth, diffuse swelling, or reddening of the breast could indicate inflammatory breast cancer. However, infectious mastitis is a more common cause of these findings and must be excluded first. The differentiating factor is that cancer-related inflammatory changes are not accompanied by systemic symptoms like fevers or chills. Any new or localized inflammation unrelated to infection should be evaluated urgently to rule out malignancy. Inflammation stemming from breast cancer arises when tumors obstruct dermal lymphatic vessels, leading to fluid congestion, swelling, and reddening as vessels enlarge. Warmth may result from increased blood flow to the area. Diffuse unilateral breast enlargement, heaviness, and red discoloration need prompt assessment, even in the absence of pain, nipple discharge, or palpable lumps. These vague inflammatory changes may be the only external manifestation of insidious inflammatory breast cancer in its earliest stage. Orange peel skin. Distinct breast skin textural changes resembling the bumpy surface of an orange peel warrant immediate evaluation, as this finding is pathognomonic for advanced inflammatory breast cancer. The peau d'orange appearance of breast skin puckering and dimpling reflects underlying edema and swelling in the subcutaneous tissue and lymphatic channels. As breast cancer cells infiltrate and block the lymphatic drainage pathways, fluid accumulates in the skin interstitium, exerting outward pressure on the epidermis. This creates superficial skin indentations and pits interspersed with raised areas that look similar to an orange peel. The changes are diffuse, affecting a large breast surface area or the entire breast. Breast cancer should be strongly suspected when this distorted skin texture is accompanied by swelling, heaviness, warmth, or redness. The orange peel finding represents cancer invasion into the dermal lymphatics and signifies advanced disease. Prevention and healing of breast cancer. While some risk factors, like family history and aging, can't be changed, certain lifestyle measures can reduce breast cancer risk. Steps like maintaining a healthy weight, exercising regularly, limiting alcohol, and avoiding extensive hormone therapy may help protect long-term health. Additionally, get screenings. Women should start monthly self-exams in their 20s and have periodic clinical breast exams. Mammograms are recommended starting at age 40 or earlier with high risk. Catching problems early via screening improves survival odds. Breastfeed if possible. Breastfeeding for over 1 year total cuts risk by up to 20% over a lifetime. It reduces estrogen exposure and lowers the proliferation of abnormal cells within milk ducts. Limit hormone therapy. Combination estrogen or progesterone HRT should be used only for the shortest duration needed to relieve severe menopause symptoms. This avoids fueling potential tumor growth. Reduce chemical exposures. Limiting exposure to substances with estrogenic effects or toxicity may lower risk. This includes BPA plastics, solvents, fuels, pesticides, and other environmental pollutants. Eat anti-inflammatory foods. Diets high in fruits, vegetables, legumes, nuts, fish, and whole grains create conditions unfavorable for cancer growth, whereas sugary, fatty, and processed foods feed inflammation and abnormal cell development. Try supplements. Emerging research shows vitamins D, B6, and E, plus omega-3s, antioxidants, and anti-inflammatory compounds may inhibit cancer progression. Always check with a doctor before starting supplements. De-stress daily. Chronic unmanaged stress and insufficient sleep may negatively impact immune function and cellular processes tied to cancer. Carve out time each day for relaxation through yoga, meditation, massage, or other activities that promote mental calm and healing. Conclusion. As covered in this video, vague yet peculiar symptoms can sometimes indicate silent breast cancer. See a doctor about any unusual or worsening concerns to help facilitate earlier detection and intervention for the best prognosis. Please like and subscribe if you found this video helpful. Together, we are winning health.